My name is Jim Sikarsky. I'm a patient of Dr. Royce. He gave me total knee replacement here on my right knee about 2 months and a week ago. My knee had deteriorated to the point where it was tough for me to walk. I could manage maybe 100 yards before it was limping badly and dragging the leg. I was in a contract job with the supervisor of elections in Orange County, and it was very difficult for me to get around in the job. Painful for me to do a lot of my favorite things, such as a morning walk, which I like to do with my wife. In looking forward, she's finally retiring, so we're moving to our home in Murphy, North Carolina, where to get anywhere, you're up or downhill, and I really couldn't tolerate it the way it was. So I went for the total knee replacement, which was the second one in my adult life. I had my left knee done about 7 or 8 years ago, and that was a completely different procedure. In the hospital for several days. It took me quite a while to become ambulatory at all. Home therapy and visits from the nurse quite regularly for at least a couple of weeks. This procedure was entirely different. It was outpatient therapy, which I found incredible when it was described to me. But in fact, it turned out to be a very positive experience.
I'm Dr. Bryan L from Orlando Orthopaedic Center. I'm one of the sports medicine specialists here. Also do joint replacement, most notable of the knee and the shoulder. Over the past 4 or 5 years, I've been implementing outpatient knee replacements and shoulder replacements into my practice. And it's been wonderful for my patients. Most importantly, it allows them to go home the same day of surgery, where they can start their therapy at home. We'll have a therapist coming to the home as well as nursing. And really it's a jump start to the ultimate recovery. The nice thing about going home right after surgery is that you have a 0% chance of a hospital-acquired infection because you never enter the hospital. And there's never been an advantage of being in the hospital over being outpatient with regards to outcome, as long as the patient is a candidate. Some of the things that we look for a patient to be a candidate for the outpatient knee replacement is that they have somebody at home with them for at least 5 days after surgery. They have to be healthy enough to be able to undergo the procedure. So things like bad heart disease or uncontrolled diabetes, or the inability to ambulate without assisted devices before surgery can be red flags of somebody who may not be a candidate for the outpatient knee replacement. James is unique because he had an inpatient knee replacement years before, and going through this process of having an outpatient knee replacement, he really thought it was a lot better for him. He enjoyed the success, and is even stating that his knee replacement that was done fairly recently is doing better than the one he had done years ago, which in that case he should even continue to improve.
It's just been very impressive to me. I was shocked a little bit to hear that it was going to be outpatient surgery because of my previous experience, and I also had been reluctant to undergo the procedure because of my previous experience. But this time I have nothing but positive things to say. The procedure was very well executed, and the personnel that supported me after the surgery were outstanding. So I'd have to say really just a positive experience. Working with Dr. Royce has been a pleasure in every regard. His staff is terrific. The appointments have been flexible in what I needed. The people here have been really just caring and very supportive. The physical therapists that were engaged for my recovery have been just outstanding. I cannot say enough positive things about them. Dr. Royce himself is just excellent. He's got a great manner. He's very direct. He tells you the story exactly as it is. We had great communication, and I feel that you couldn't do wrong with him if you're contemplating this kind of a procedure. Come and talk to him.